right, thanks everyone for coming to the chat seminar this week. We have Ben Hansen joining us this week. Ben is a W. Minor Professor of Economics at the University of Oregon. He does research in labor, health, and public economics, and the economics of education as well. He's published in top journals in the field, the American Economic Review, the American Economic Journal, Journal of Economics, and the list goes on and on. So we're very fortunate to have such a great scholar here joining us today. Today he's going to present some of his work on risky health behaviors. The title of his paper is The Grass is Greener on the Other Side. He's looking at marijuana trafficking. Ben, thanks so much for coming.
Great. Thanks a lot for hosting me here today. It's been a great day so far. For those of you I haven't met with, I'm looking forward to meeting with you this afternoon. And thanks again for the invitation to be here. So I have to confess, this is actually the third title we've now been through on this paper. So it started off a little bit more mundane. How extensive are the interstate spillovers of marijuana? Or actually, maybe it's the fourth title. At another point, it was something about interjurisdictional spillovers and something. And then it became drug trafficking under partial prohibition. And then I had this eureka moment that the grass really was greener on the other side. And I thought that I was so clever. And then I discovered over lunch that I actually committed plagiarism, stealing a book title from Chris's mother. So I might have to go through and change the title again. But thanks again for having me. So I think it's safe to say we've reached a major tipping point in attitudes on legalization. And I had actually bragged yesterday on Twitter that my slides were perfect, and I've just realized they aren't. Because another example of this tipping point has been, major public figures in the Republican Party coming out and saying, maybe medical marijuana isn't so bad. And certainly if we were to just look at broader perceptions of marijuana, those things have been changing based upon the best ways that we can track them in governmental surveys. So, if we were to look at, and this was also another slide I meant to update, dang it. So Alaska, Colorado, Oregon, Washington have had legal markets for several years now. California just recently joined this list, so did Nevada. Pretty soon Massachusetts will be joining it later this summer in July. So I guess that might make for an interesting NBER Summer Institute. But with all these changes happening, there's a lot of things we don't know. And some of these things relate to some informal federal rules that were given out via the Cole memo back when under the Attorney Generals under President Obama. And so we'll go into some more details about that. But one of the key goals that was put forward in this was issues surrounding diversion, or does the marijuana stay where it's legal? And that's something that we'll be seeking to address. And most of the prior research that has been out there about marijuana has mostly concerned illegal markets or medical markets. Certainly, Joe's published some papers on that. I have too. And certainly, I do think there's a lot that we can learn from the medical marijuana markets, but that doesn't tell us exactly what we're going to expect once it becomes fully legalized. It doesn't tell us exactly how these legalized markets are going to behave, who's going to be the marginal consumers in those markets. Certainly, just a major change that I've noticed in Oregon has been the extent of advertising. That medical marijuana, even if it was available before, it wasn't advertised where the marijuana was available, or what strains were popular this week, or what prices things were going to be charged. And that has been a complete transformation in just Oregon newspapers or billboards, where you can now see, you driving up I-5, there's a billboard that says exactly how many miles away the nearest retailer is. And I wouldn't be surprised if similar things are happening right here in San Diego, although I haven't had too much of a chance to explore the city to see the depths of it yet. And some other evidence on the tipping points of marijuana just comes from basic surveys like the Gallup survey. Certainly, if we were to go back to 1969, we would find almost every American in the country felt that marijuana should stay illegal. Yet, fast forwarding to today, and now, it's not just the median voter that thinks that marijuana should be legalized. It's far beyond that we're now to the point of a supermajority. And if we were to look at even breaking this down by political affiliation, we would find that by far and away, nearly all Democrats support legalizing marijuana fully, or at least legalizing it for medical purposes. And even the median Republican voter is okay with the idea of medical marijuana for some uses at this point, even though they haven't fully altered their beliefs about recreational marijuana. So if you were to wonder kind of like what's going on in California right now, certainly some of this you're experiencing and seeing firsthand. To just get a sense of what the timeline was of cannabis in California, it was decriminalized in 1972. But medical marijuana was first introduced in 1996. And then in 2003, ironically, Senate Bill 420 clarified an earlier law. And this was regulating the role of retailers and dispensaries and where they could be and where they couldn't be. And really after this change happened in California, that's when we saw a sudden kind of groundswell of dispensaries kind of popping up all over the state. To at one point, there was hundreds of dispensaries up in Los Angeles, although they ended up shutting down about half of them in 2009 because they were too close to schools and for other reasons. So then, of course, Proposition 64 was introduced in 2016. You, the voters, well, I don't know if it was you, but the totality of California supported the measure. And so this legalized marijuana for recreational or any consumption for any adults who are over the age of 21. And it also instituted some additional taxes that would be collected. And we might come back to this just a little bit later in the talk, although it's not a key part of the discussion today for marijuana diversion. It does relate to the issue of how much crowd out will there be between recreational marijuana and the black markets. And if you were to look through California's marijuana news feed, which I spent a fair number of the last couple of days doing that just in preparation for today, you would find that most of the articles are around the tax rates right now. That a lot of the marijuana lobby, which is now an official lobby up in the Capitol, they feel that the tax rates are too high and that this is going to make it more difficult for them to drive out the black market. And that really, if you vote for higher marijuana taxes, you're voting for crime. You're voting for illegal drugs, which is, I guess, it's a nice place to be able to pitch yourself as a lobby. In terms of how high are these taxes? Well, so there's some initial cultivation taxes that are charged. So when people grow marijuana and cultivate it and process it, there's a $9.25 per ounce tax on any flowers. There's a $2.75 per ounce tax on dried leaves. So these are then turned into usable marijuana. When it's sold at retail, there's a 15% excise tax that's then charged. And then there's also any state and local sales taxes added on top of that. So the main thing that they're lobbying is to try to eliminate and potentially reduce these excise taxes. We can talk about some of the distortionary effects these separate taxes at cultivation and excise taxes might have a little bit later too. Certainly, or one thing they could do is potentially encourage the growers to produce very high potency marijuana, because the very high potency marijuana, they're going to pay the same tax per ounce that's charged, so they might as well produce marijuana that will be more expensive and more potent, or at least that's the incentive that this type of tax would tend to provide. And we have some evidence on some tax reforms that happened in Washington state that are suggestive of this very thing. All right. And if we were to look at California, what the immediate future will look like, some other interesting challenges is what to do in the financial sector. Because most of these firms can't actually use the typical financial industries of banking the way that we do. If we have a business or if we have a personal checking account or a savings account, most of us can go down to a bank and open up an account pretty freely. For marijuana businesses or for marijuana entrepreneurs or business owners, they can't do that. And that's because it's still a Schedule I drug at the federal level. And consequently, if a bank let that money come into it, they could be subject to a RICO lawsuit. And then they would have to turn over all of their books to the FBI. And the bank doesn't want to freely let the FBI go for a fishing expedition for whatever they could find in there. Consequently, most of them operate on a cash-only basis. Most retailers will only take cash payments, which has its own kind of effects on the industry. You tend to see prices organized in very discrete units. So usually, including the sales taxes, all the prices almost end up being rounded to single numbers. So it'll usually be $11 per gram or $15 per gram. You'll very rarely see any additional change being collected just due to the transaction cost that creates for them. Some other things it encourages them to do is invest a lot in private security, because they end up with a safe in the back of their store that might have hundreds of thousands of dollars in cash in it. And so they have to invest in this safe, they have to invest in that security, they have to invest in the cameras, both to protect the product that they're selling and to protect the revenues from it. The limited access they have to financial institutions includes mostly local credit unions, because those credit unions usually don't have affiliations that cross state boundaries. And so because of that prevents them from being subject to the same sorts of federal restrictions that most national banks would. But there's going to be a lot of money being poured into this, and that does suggest there'll be a fair amount of tax revenue collected as well.
Could that be what's driving? I mean, recently you alluded to John Boehner, for example, coming out sort of joining a sort of a lobbyist group for taking marijuana off of the Schedule 1 drug list of the feds. Do you think it's sort of driven by some of the financial sector sort of stuff?
So maybe. I mean, it could be that. It could also be, the fact that public attitudes have changed on this, right? Like if the median voters have really changed their attitude on this, you don't want to lose those marginal voters. And one way to potentially keep those marginal voters might be to kind of shift the party's stance on an issue. We haven't yet really seen broad movements in either political platform, though. There's been individual members of parties that have been spoken out, and there's been, I think Cory Booker introduced a bill to legalize cannabis at the federal level, but there hasn't really been nobody's been really both sides are being pretty risk averse on that front.
This is one of the biggest costs of keeping it as a Schedule 1 sort of.
Is the financial? Yeah. So certainly that's one cost of it. Yeah. There are some benefits to the federal government too, though. So the chief benefit right now that the federal government has, although that's not a focal point of this talk, is that they get to tax marijuana without ever saying that they're instituting an excise tax on marijuana. And that's because every business out there, if you're an illegal enterprise or a legal enterprise, you're still required to file income taxes. That's what Al Capone went to prison for pretty famously. And so all these medical marijuana firms and now recreational marijuana firms still have to pay income taxes. And usually most of them are the sole proprietor or owner of these marijuana firms. And because it's an illegal enterprise, that changes what they're allowed to deduct. The only thing they're allowed to deduct is the cost of goods sold. So they can't deduct their employee expenses, they can't deduct their lease, they can't deduct any of those other input costs that would go into it. Consequently, a lot of these marijuana firms, if we were to look at kind of the median retailer in Washington, they might be making over $1 million a year in revenue, yet they aren't able to deduct very much of it at all. So that really makes their effective tax rate closer to the maximum statutory rates. And if they were to legalize marijuana federally, until they put in some federal excise taxes, we would actually see federal revenues probably dip. Because the states where it's legal, it would continue to be legal. And it would take a fair bit of time for there to be enough entry in the other states to make up for that initial gap in revenues. But right now, they're already making billions of dollars of federal income taxes from these firms that are paying taxes without being able to deduct anything. So, and there's been some discussion right now about the California's tax rate, and there's concerns that this could push buyers into the black market. And certainly one element of the black market is people purchasing marijuana illegally. Another element of the black market is marijuana from one state ending up in another state where it's illegal. And that's the key issue that I'll be focusing on today. And some of the other ignore the puppy ad over here. I guess at the time, I came up with this news story, but I was also doing some searching for puppies because we got a puppy this winter. She's now 6 months old and recently discovered she could chew on carpet. So, yeah. Yes?
So as I understand it, the medical market doesn't face the same excise tax, right? It's tax-free if you're purchasing through medical channels, right?
So that's true in California, yes. So they don't have to pay excise taxes, but a medical marijuana firm would still have to pay personal income taxes.
Sure, no,
Yeah.
So I guess I'm just thinking, so you said this sort of focus on this paper, and I'll grant you that, is this sort of state substitution effect.
Yeah.
It seems like I would argue probably that a larger substitution effect is from the recreational market, from the medical market to the recreational market.
Yeah. So we are seeing strong evidence of that in Washington. If you were to look at kind of the number of sales they had in the medical market, that's consistently fallen over time. Yeah, so I do think there will be a substitution from medical marijuana over to the recreational marijuana. And that'll be pretty common in probably California throughout over the next couple of years. Part of it also might be due to differences in licensing. A lot of people that have medical licenses for marijuana now might keep their license for this year if they had already paid for it, but then afterwards they might let their license lapse if they don't want to continue paying their own personal license fee so that they can purchase marijuana medically to avoid taxes. And so I think we will see that push and that drive eventually.
Did you look at did you have any data on medical in Oregon? In Oregon when Oregon legalized recreational? So your paper looks at this substitution to away from Washington.
Yeah.
Do you also look at around the same event substitution within Oregon?
So the substitution in Oregon between medical and recreational is 1-to-1. So when I get to Oregon's unique law situation, I'll explain why the medical marijuana industry in Oregon immediately became a recreational marijuana industry all at once. So there was kind of some unique things that went into that. So there's a lot of pressure from the federal government, and that's actually increased with Jeff Sessions becoming Attorney General. So as I mentioned, the Cole memo had one of these guidelines, which was that we should states have to be trying to prevent some things. One of those things is diversion. And those incentives and that focus has become that much stronger as Jeff Sessions has taken over. So here's some of the key questions that I think exist right now. One, what's going to be the consequences of what I would argue the state that we're in with marijuana, which is one of partial prohibition? That we have some states where it's legal, but then we have a broader federal prohibition on top of that. I'll also argue this will probably be the likely future of marijuana for years, if not decades to come. That's not just because we have no movement at the federal level that it continues to be a Schedule I drug, but it's partly that states are going to have their own preferences and take their own actions. So even if we were to legalize marijuana at the federal level, we would still have some states that would continue to treat it as an illegal drug for years, if not decades afterwards. If you want an example or an anecdote of this, you don't have to look any further than Kansas, which kept alcohol illegal until 1982. So Dan Reese wrote a paper about this with Mark Anderson and Ben Crost. And they were so adamant about this that the only place you could buy alcohol in all the state of Kansas were clubs that you had to be a pre-registered member of. And the Attorney General of Kansas actually wrote the airlines and asked the airlines to put the alcohol cart back away when you entered into Kansas airspace. So it was like that scene in Argo with Ben Affleck when they enter into, I think, airspace over in Iran and they put the alcohol cart away. That you had the same thing going on in Kansas. So I would bet Kansas would do something similar today. Even if it became legal at the federal level, Kansas would say, that's fine, it's illegal here. And that would we would still be in this environment where it's legal in one place and illegal in another for the foreseeable future. And so given that, we're going to ask, well, what's the consequences of this interstate smuggling? So How extensive will it be? What are going to be the public health consequences? So what are going to happen to prices? What's going to happen to stigma? What's going to happen to the dosage or the potency of marijuana? What's going to happen to teen drug use? And these are related to the broader issues of how do we tax marijuana and what are other regulations that we're going to potentially introduce as we go from this previously existing black market that was then replaced with this quasi-gray market of medical marijuana, and now that we're finally moving over to more legal markets, but we're still going to be shying away from something where it's fully legal. So if you're wondering what's kind of the current state of the union, over in green are all of the states where we have recreational marijuana. So we have or legalized recreational and medical marijuana. In this dark gray are going to be all the states where we have legalized medical marijuana. And then in this light gray, without the states being labeled, those are all the places where it remains completely illegal. And it's worth noting that medical marijuana isn't the same thing in every one of these states. So if you were to look, for instance, at Arizona, the medical marijuana regime there is going to be very liberal. It's very easy to get a license, so the sets of conditions that you can get licenses for include very difficult to diagnose conditions. If you were to look at the registry of patients, you would find that the average person on the medical marijuana registry in Arizona is a male between the ages of 20 and 40. And their most common medical problem is trouble sleeping or lower back pain, which I'll give that those are things that afflict people my age, but there's a lot of other things that might ail them, such as boredom. Likewise, when we look up into the Northeast, we could find a place like New York that does have medical marijuana, but there's very few dispensaries that actually provide medical marijuana. And there's very few medical conditions that they're willing to give medical marijuana licenses for. Namely, terminal conditions are going to be the only ones. And that's going to be true of most of the medical marijuana establishments in the Northeast. So even if you were to look at the East Coast and say, really, this isn't too different than the West, these things are far more different than just this color coding of laws would actually reveal to you in terms of the availability. And just the prices themselves would reveal a similar comparison. That marijuana itself is going to be a lot cheaper here on the West Coast and of higher potency than the marijuana that you would find here on the East Coast, even if the laws look fairly similar to each other. So Washington itself is going to provide a unique opportunity to study these recreational marijuana markets for a couple of reasons. The first thing is that we have really a comprehensive administrative data set that makes it possible to study the entire supply chain of recreational marijuana. So Washington probably adopted the best seed-to-sale tracking system. So every time a marijuana plant is planted, the firms are, at least by law, required to report it, and it appears that most of them do. So they report when plants are planted, when they're harvested. They also are required to report the results from tests for potency and biocontaminants. They also report the date on which things are sold at the wholesale level, the date at which they're then transferred to the retail level, all those dates of transfer, and their weight at every one of these steps. So that gives us really the universe of market activity in the entire production supply chain. And so we can know the sales and the prices at each step of this production process. Likewise, we have an ideal natural experiment offered by Oregon's legalization, and especially for measuring interstate spillovers. And part of the reason that this is an ideal natural experiment is that there's a lot of reasons that we couldn't necessarily look at a state that unilaterally legalizes on their own and look at activity in neighboring states to infer something about if interstate spillovers, the way I'm talking about them, are actually happening. So for instance, if we were to look at Colorado legalizing marijuana, and we were to find reported usage increasing in Kansas nearby, it's not clear that people from Kansas are actually driving over into Colorado, or if just the media exposure that they see affects their preferences. and just their attitude towards marijuana has shifted. Likewise, if we were to look at arrest records, and suppose we were to find that arrest records go up in Kansas after Colorado legalizes marijuana, it's not clear that people are actually purchasing marijuana and bringing it back over the border, or if just sheriffs in Kansas or other forms of local law enforcement are aware of Colorado legalizing and are trying to prevent people from engaging in that activity. So it could be that we could measure something that looks like a spillover, and it really isn't that at all. It's just that people are trying to prevent that from happening, and so it makes it look like it is. The only way that you could really measure something that would look like a spillover would be to take a state where it's already legal, have a state nearby where it's illegal, and then have that state where it's illegal legalize. And then if states fall along the border between those two legal places, then that at least is highly indicative and offers very compelling evidence that individuals were likely crossing the border and purchasing it in the other jurisdiction and then bringing it back. We test some other potential mechanisms that there could be other than this type of trafficking. So we test for mechanisms such as drug tourism by looking at the size of marijuana transactions. So are they purchasing 1 gram, 2 grams, or are they purchasing much larger amounts of marijuana? And we find evidence that it's most of the decline in sales we see is driven by large transactions. Another thing it could be a problem of what I would call reverse trafficking, meaning that marijuana becomes available in Oregon and maybe it's cheaper. Or maybe it's more convenient because some people cross the Oregon-Washington border for work purposes anyways. And so we could see a decline in sales in Washington due to that. And so we study the effects that a differential price change that happened in Oregon that occurred a few months later in January, and we find no evidence of that response. So when we look at other mechanisms or other plausible channels, we don't find any evidence supporting those, which leads to the original conclusion that this was likely due to trafficking across the border. But this was also a plausible natural experiment, because on October 1st of 2015, there was an abrupt change in Oregon's law that we can study and exploit. And I'll go through why I think that's actually plausibly exogenous. The key thing that had happened was that Oregon was feeling a case of keeping up with the Joneses. So Washington had legalized marijuana a couple years earlier in 2012, and then they had this legal market that opened in July of 2014. And people could, and in Oregon, they were kind of feeling left out. Maybe it's because they had both originally passed medical marijuana laws back in 1998. But in 2014, Oregonian voters voted to also legalize marijuana. It passed pretty easily. And the original plan was that Oregon was going to take 2.5 years to introduce a fully recreational legalized market. The same thing that Washington did. So when Washington legalized, they took this over 2-year period to introduce their seed to sale tracking system, to introduce the licensing, to introduce the taxation, to create the Washington Liquor and Cannabis Board that was going to oversee the regulation of this. And in Oregon, that was their original plan. And then the constituents of Oregon, towards the middle of 2015, decided they had had enough. If marijuana was legal in Oregon, they wanted to buy it. Because that oftentimes when these laws changed, it meant that the marijuana was legal, but you couldn't find it anywhere. Or you couldn't find it anywhere without getting a medical license, which would cost a couple $100s. So there was a huge groundswell of support, people putting pressure on the governor and the state legislature. And so the state legislature decided, fine, enough. They passed an emergency bill that allowed for any firm that had been selling medical marijuana to sell immediately in the recreational market. So rather than introducing the entire licensing regime over a couple of years, the way Colorado did, the way California did, and the way California has done, or the way Colorado and Washington and California has done, Oregon, jump-started things as quick as they can with very little notice. And so if we're talking about substitution in Oregon between medical and recreational, these things really kind of became one and the same, at least at that time period in October of 2015. Yeah?
How far after is your study window after the policy implementation?
Yeah. So we studied we focused on 2 months afterwards.
Okay, so like not enough time to have like firm entry into the market.
In the Oregon side of the market, you mean? Yeah, so not enough time for entry to happen. Part of the reason that we did that was that we didn't want to end up being conflated with another tax change that happened in Oregon. So initially, when all these firms switched from medical to recreational, they were allowed to sell without any taxes. And then on January of 2016, then they had to start charging a 25% excise tax. And so we wanted to avoid any effects that those price changes could have as well in the Oregon market. So that's why we stopped it 2 months before and 2 months after. Yep. So we're going to look at sales of marijuana in Washington before and after Oregon's legalization. And we're going to examine the gradients of sales by looking at the distance to Oregon. So we'll look at the Oregon border as treatment, and we'll look at some potential counterfactual groups in Idaho and Canada. And I call them potential because we don't know if there's spillovers happening there or other things that are also changing simultaneously. Yes?
I was just going to ask, on the Oregon, when they switched it on October 1st, how much warning was given before that? Did they know, like, you know, in early September that was going to happen? Or
oh, yeah. So they had known since earlier, I think it was in July that they announced that they were going to switch it over. Yeah. So we can examine the effects on prices. We can examine the effects on quality. We can examine the elasticity of supply because we can determine other channels through which the Washington suppliers might have adjusted. Because we know all the orders they were placing to their suppliers. And so we can see what was happening at the wholesale level at the same time that what was happening at the retail level. And so we can see how these firms responded to what I would consider a pretty large demand shock. And usually when there's a large demand shock, at least everything I learned in Econ 101 says demand shock happens, like we should expect price to go down. And so we study what happens to the prices that consumers were paying and how firms adjusted. And so we're going to estimate this using reduced form models, using Oregon's legalization as a quasi-experiment. And we'll use some regression discontinuity and time estimators, some difference in difference estimators, and some differences in discontinuities estimators where we have a discontinuity centered along the Oregon border, and we have a discontinuity centered around the Idaho border, and then we take the difference between those discontinuities. So we offer contributions, I think, to several literatures. There's been previous research looking at the violence due to drug trafficking. So Melissa Dell has some research looking at down in Mexico. There's also a recent study published in EJ looking at violence along the border here in California with medical marijuana laws, where they find that crime fell with medical marijuana legalization in the late 90s. Then there's been some other prior research on geographic spillovers. So most of this research has involved tobacco. A little bit of it has looked at alcohol. And they found, for instance, in a place like New York City, that nearly 80% of the cigarettes in New York that are smoked there aren't actually purchased in New York. And the way they confirmed this was by digging in the trash. So they went around and they dug through all the trash cans in New York City and they got the cigarette packs out. And by getting the cigarette packs out, they can look at the stamp that are on those packs. And that stamp might say New York, but more often than not, what did it actually end up saying? New Jersey, sometimes Philadelphia, or Pennsylvania, or sometimes it had no stamp at all, indicating it came from tribal lands up in upstate New York where no taxes at all were collected. And so that constitutes 80% of the cigarettes there. There's been a little bit of research looking at alcohol, as I said, but generally what we've learned from those literature that said geographic spillovers could matter doesn't necessarily tell us that they'll be here. It doesn't tell us necessarily how big they'll be. Because in many of these contiguous regions, you might have a state where it's illegal, such as Oregon, and a state where it's legal, such as Washington. And the act of carrying cigarettes from one place to another isn't inherently a felony. But that is true for marijuana as it's a Schedule I drug, which is actually an interesting thing to think about the salience of different types of crime. Like the closest comparison I can really think about for this is the perceptions that people might have about how criminal it is to steal a CD I guess if you still can steal CDs, I know it's hard to find them, but I guess they still have CDs in some parts of like Best Buy, although cars don't come with CD players anymore. But I think if you were to ask most people, is it illegal to go in and take that CD off the rack and walk out of the store with it, 95% of people would say, yeah, that's definitely a crime. If you were to ask people, well, what about downloading an MP3? Then you might have some people that think it's a crime, some people who think it isn't. Certainly, if you were to take an MP3 and copy it from one computer to another, does that feel like a crime? You know, if it's your friend's physical computer? And whether or not it is or isn't really depends upon the DRM, the digital rights management, which most of us don't really carefully look over to see if we're really adhering to that. And likewise, in this case with marijuana, people probably could feel like this transaction is legal because they're going and they're buying it legally, even though the action of bringing that across state boundaries is fundamentally an illegal one. It's a felony. And the alternative they had in Oregon, given that Oregon had already decriminalized marijuana, would be to purchase it from a drug dealer, which that action probably felt very illegal to them, yet it was actually perfectly legal, at least for the person buying it. The person selling it was selling out without a license, you know, so they can be subject to like a fine of, I think, about $500. And I only know that because there was a news story recently in Portland that a kid got a ticket for selling lemonade without a license. When I say a kid, she was like 10 years old. And a health inspector came up to her and asked for her license for the lemonade stand she was running. And it was a whole news story. It was pretty great. Yet that's the same, that kid selling lemonade that got a $500 ticket, that's the same sort of crime that selling marijuana was prior to it being fully legalized in October of 2015. And so this probably relates to a lot of other research about supply-side drug policy, most of which has looked at meth markets. But certainly as we move to this environment of partial prohibition, it matters a lot how elastic the supply of firms are, or the supply of drugs is. It matters a lot how much we should expect for interstate spillovers. And I would say econometrically, this is also an important thing if we just want to measure public health outcomes. So if we're interested in the question, does recreational marijuana law increase traffic fatalities, which is on the list of things that have recently been blamed because traffic fatalities jumped up considerably in 2016. Some people have pointed to increases in high-related fatalities. Other people have pointed to Pokemon Go or cell phone usage. So those things could be factors. But if we were to, try to compare Washington, where marijuana was recreationally legalized, and Colorado, where it was recreationally legalized, and compare those to other states on the outside, which a published study in the American Journal of Public Health did, and a published study in the Journal of the American Medical Association did, and so they did this in a standard difference and difference framework, we would expect those difference and difference estimates to be biased towards zero if there's interstate spillovers. Because they're considering Oregon part of the control group, when if there's actually interstate spillovers, they're part of the treatment group too. And so finding a null effect with both of those studies did, that might be right and it might be wrong. And so we should at least be aware of and account for interstate spillovers if we want to measure the impact of recreational marijuana legalization on public health outcomes. All right. So Washington's legal framework was in part driven by a Department of Justice memo that was released in 2013. So this was after the Colorado and Washington both legalized in 2012. And so the Cole memo had a couple of key things. One was that they wanted to prevent marijuana revenue from funding criminal enterprises. Another was that they wanted to prevent teen drug use. And another key thing was that they wanted to prevent the diversion of marijuana from states where it's legal to states where it's illegal. And it said as long as states do this, then federal resources in your states are going to basically, we're not going to focus on the marijuana industry. We're going to leave it alone. Even though we officially could go in and raid every recreational marijuana retailer for being a drug dealer, we won't do that as long as these goals are being met. And I think that continues to kind of be the guiding spirit for federal drug enforcement authorities. So even though Jeff Sessions recently kind of came out and changed like a few public statements about this, they certainly haven't started to knock down any doors yet. And that highlights that this continues to be a major policy goal. So if you just look at the original Cole memo back in 2013, this is just the beginning of it, yada, yada, yada. And then one of the key things that's outlined is that we want to prevent the diversion from states where it's legal to states where it isn't. And so one of the goals of this paper is to just ask, how reasonable is it, or how much should we expect this to happen? And where should we expect to see this particularly relevant? So as I said, the Washington marijuana data, if you're interested in doing research with it, it's pretty easy to access. For right now, it's free. They might start charging for it. But you can set in a public records request, and then you'll get information on the production, the processing, and the retailer. So it's all at the transaction level. So I think if you were to download the data now, there'd be probably about 500 million transactions recorded in the data, perhaps more. So make sure you have enough free space on your hard drive. There's three key steps involved in the supply chain. The first thing is the production. So this is marijuana when it's grown and then harvested. The next is the processing. So this is when flowers are cured and they're turned into usable marijuana. And these larger parent lots are then divided into smaller packages. And in Washington, they're actually distributed in packages that are sealed and closed for resale. So you'll see very common values that the marijuana ends up being sold in. So it could be sold as a pre-rolled joint. It could be sold in a 1 gram package, in a 2 gram package, or a 7 gram package. And so that'll be one of the things that we'll look at is the size of the transaction or the size of the packages being sold. So then at the retail level, we see when the purchases happen. For a lot of them, we can actually see the exact time of day, but we definitely see the exact date on which it happens. And then inventory usually sits on the shelf for about 3 weeks. And then afterwards, at some undisclosed date that we don't know, because all we have is the transaction level data, people consume the marijuana via an additional apparatus. So the marijuana, when it gets sold at the retailers in Washington, it looks a lot like this. So these are just some versions of the packages. So you can see each package of marijuana is going to have a unique barcode. So it's scanned into the system when it gets transferred to a retailer, and then it's scanned in again when it's sold. So that way we can keep track of all the data through the marijuana system, the traceability system. It almost kind of looks like the types of packages I see like iPhone lightning bolt cables coming in these days. Guess it might be kind of a different type of lightning. So Washington itself does have some interesting restrictions. So producers are limited in the size of plant canopy they're allowed. So they're allowed some economies of scale, but they aren't completely free to set those. They're also limited in the degree to which they can vertically integrate. So firms can have both a producer license and a processor license, meaning you can grow marijuana and then you can harvest it and turn it into a final usable product, but you're then not allowed to have a retail establishment to sell that in yourself. So the production process is inherently kept separate from the retail process. That's something that's separate and distinct from Colorado, where Colorado instead has very strict requirements of vertical integration. So firms have to produce at least 80% of the marijuana they sell at retail on their own. So in the long run, there's going to be like a lot of interesting I/O questions that come out of this about the efficiency of vertical integration versus horizontal integration. And so there's going to be a lot of different research questions to address in this. Yes?
So what is home cultivation?
Oh, so home cultivation means can you grow it or not in your garden? So right now in California, I think home cultivation is allowed, right? So you can grow, is it 6 plants? All right, so 6 plants. So in Oregon, you can grow 4. In Washington, though, there's very strict limits on home cultivation only for medical purposes. So there's no allowances for home cultivation for recreational usage. And retailers themselves, they're allowed to vertically integrate somewhat, but not completely. So you can have 3 locations. And individuals in Washington are limited to a single business interest, either themselves or through family connections. So for instance, I can't own a retailer while my brother owns the processor and producer that then he transfers to me. Or the same would go for my spouse. So then Oregon comes along in the middle of Washington having recreational marijuana and legalizes. And as I said, if we were to look at kind of the timeline of events, we have Washington and Oregon legalizing medical marijuana at the same point. Washington then legalizes recreational marijuana. The first licensed dispensaries open in Washington in July of 2014. Later that year, Oregon's legalized marijuana. They feel really jealous, so they legalize possession, and then an emergency bill allows all of the medical retailers to convert over to recreational on October 1st of 2015. So we've already talked a little about the supply chain. I'm going a little bit slow, so I'd like to speed up. So the main models that we're going to estimate are going to be regression discontinuity models in time. So we're going to estimate the causal effect of Oregon legalizing. So we'll have the main coefficient of interest will be alpha 1 on this dummy variable here. We're also going to control for day of week fixed effects. We'll also allow for potentially an adjustment window if we want to as well, where we could vary this adjustment window from a few days to even a week if we thought there was some short-term disruption to see, is this effect, is it only restricted to a couple days? Or so do people buy the marijuana locally in Oregon when the market opens and then go immediately back to Washington where it's cheap? That might also rule out the idea of, did Washington people come over here to support this market and try out this new marijuana weed and then go back to where they were? So we'll test for those adjustment windows. We'll also control for seasonality and in day of month fixed effects. And then we'll control for some polynomials in time, which will vary from, we'll try everything, including a 5th order polynomial and limit it all the way down to just a 1st order polynomial. And we find that our estimates are basically completely robust. So the key assumption, though, that we have in this model is that there's no other changes in demand coincident with Oregon's market opening. And maybe this could happen, and maybe it couldn't. So if we think of like October 1st, that roughly coincides with like the academic calendar beginning if you're on like the quarter schedule. So you might worry like maybe there's some like effects of like college starting. Maybe there could be some other seasonal effects that happen. Certainly if you're to look at season of year, there's consumption patterns are going to be different in the summer versus other months of the year. So you might want to look at some counterfactual groups. So that's why we'll look at what happens along other parts of the border. So we'll look at Idaho, we'll look at Canada, we'll look at the entire rest of the state. We'll actually estimate these for every individual firm in Washington and then just kind of plot out non-parametrically what our estimated coefficients look like based upon the distance to Oregon. So we have a lot of different ways we can cut this up because we have transaction level data for every single firm across the state. So the limit of our ability to analyze things is mostly like due to our patience and our creativity. But this will be the key underlying assumption, which we'll try to test through some other things. So if we were to wonder where are we going to expect to see the biggest effects, there's a couple of key firms that we might take a look at. So this is just a graph of the state of Washington here. We have Idaho over here. And then this is Oregon. And then we've shaded these border counties in Washington based upon we've colored these counties in Oregon to highlight which border county in Washington is the closest border crossing for those counties in Oregon. So this means if you were to look at, Lane County right here, so this is where the University of Oregon is. That's where my house is, right? And you were to ask, well, where's the closest place for me to go buy legal weed up in Washington? It'd be over here in Vancouver, which is on the other side of the Columbia River over in Washington. And if you're wondering, do they know that they're actually entering Washington to buy this marijuana? The answer is undeniably yes. because there's this giant river called the Columbia River, and it separates Washington from Oregon all the way over to here. So if you're asking, do people know that they're in Washington? Yes, they're crossing a bridge. There's a sign that says leaving Oregon as they go on the bridge. There's a sign that says entering Washington. I don't know if it can be any more salient that you're going from one state to another than this right here. So it wouldn't necessarily be as confusing as some other places on the eastern seaboard if they know where they are. They definitely do here. So for all of this western region of Oregon, the closest place for you to get marijuana is at these retailers here in Vancouver. Then if we were to look at most of eastern Oregon, the nearest firms are going to be over here in Klickitat County. So this is kind of an interesting case to look at because this is an urban crossing, right? We have Portland and then we have Vancouver on the other side. And then we also have a more rural setting. So this is, almost 100 miles from Portland. And it isn't the closest border crossing for metro areas, but it is the closest border crossing for a lot of rural regions in Oregon too. And so we're going to analyze the effects both statewide for all the border counties, and then we'll separate it out county specifically to see, are the effects bigger in this county here, which serves as the majority of the border crossings for everyone in Western Oregon, versus this county here, where it's the closest border crossing for most of the people in Eastern Oregon, but both of those are serving both an urban versus a more rural population. And then we can see when we look at the other border crossings, up over here on the other side over from Astoria, it doesn't serve very much of this. It isn't the closest place for most of the state of Oregon. So if you just wanted a table because you're like, Ben, I know you're doing a regression discontinuity in time, but you're doing way too much work. Just show me the diff and diff. Go back to Card and Kruger 1993 and just show me the basic diff and diff. This is the Card and Kruger 1993 table. So here we have the Oregon border counties. We have the amount of marijuana being sold. So this is in grams the 2 months prior. This is pre the Oregon market opening. So this is August and September. This is post the Oregon market opening. So this is October and November. And so if we were to look at the Idaho border counties, what we would find is that sales from August and September to November and October basically stay almost flat. They go up by about 30,000. If we were to look at the Canadian border counties, sales go from 305,000 grams to 303,000 grams. So basically flat. If we were to look at the rest of the state, they're actually going up from 3.7 million grams to 4.1 million grams. So everywhere else in the state, it looks like sales are either flat or maybe even going up. And when we look at the Oregon border counties, that's the only place where we find a discrete drop. That sales fell from 572,000 to 425. So these are just kind of some of the baseline summary statistics. The price per gram that we're looking at is about $9. The average weight in grams is about 511. So that's just like total weight sold per day. We also have the total number of sales in terms of the number of transactions. There's about 239 grams. On a daily basis, most of these firms we can track their revenue. They're making about nearly $4,500 a day. And then we also have some information about the potency of marijuana to see did firms adjust how potent the marijuana was when they were selling it? Did they switch from like higher quality marijuana to cheaper marijuana? We also know some days from wholesale. We have some information about how competitive the market is. And some other key things we can measure is how big their inventories are. And so we'll kind of go through and explore all those things. So in case any of you have to go run and teach a class, this is kind of the key figure at this point. What we see is Oregon market is kind of like, so these are the Washington stores along the Oregon border. Sales are, basically moving around. There's some day of week fluctuations. We haven't necessarily taken out all those dummy variables. But then as soon as Oregon legalizes, there's a drop. And so Oregon legalized on October 1st, which was a Thursday. And so on that first Thursday, we see, a drop. It's worth noting that transactions usually on Thursdays are a fair bit lower than transactions on other days of the week. On Friday, they drop even more. And then by Saturday, they've dropped by about 40%. And that's basically the level we stay at for the next 2 months. The only variation we really start to see away from this is when we start to get into late November. Does anybody have any guess about what day this is right here?
Thanksgiving.
Yep. And do you have any guess about what this day is?
Black Friday.
Yep. So, and when we look over at Idaho border sales, we still see that there's a Thanksgiving effect. We still see, there's Black Friday, things kind of rebounded. But when we actually look at what happened around October 1st, these are two different polynomials that we've estimated. Yet, at least at this level of resolution on a computer, you can't see any difference at all, because there was really no change in sales. Yes?
So those marijuana retailers have Black Friday deals?
Small. The bigger deal is 420, which is tomorrow. And so we'll talk a little bit about 420 at the end of the talk if I have time. And then if we look at the Canadian border, if I do my Rorschach test, I'm not sure if I see anything. If we look at our estimate, maybe sales went up a little bit, but it's not statistically significant. Again, is there like a Thanksgiving effect? Yeah. Is there a rebound effect the day after? Yeah. But that's just some annual seasonality. We've actually learned some newer regression, discontinuity, and time techniques to try to take these things out. So there's recently an NBER working paper about this. They basically advocate looking at your entire data set to estimate some of these like seasonal effects that you think are important. Because we usually can't do this if we have just these 2 months before and after, because we don't have multiple Thanksgivings. But you look at your entire data set. So we have 3 Thanksgivings. Estimate that Thanksgiving effect each time. Take out the average Thanksgiving effect, whatever average rebound effect there is. And really for holidays, if you are interested in using data like this, it's probably something pretty reasonable to do when you're doing research at the daily level, because there are some pretty big swings at the daily level. But as you can see, these types of shocks, though, are something that are pretty common throughout. And certainly it's far enough away that we can investigate bandwidth sensitivity to make sure that those things aren't biasing our estimates, even though they're pretty far away from the threshold. So if we look at just the retail firms at Oregon, we estimate there's a 41% decline. If we look at along the Idaho border, we might estimate there's a 3% decline. If we look at Canadian border, depending upon what we control for in the model, maybe there's a 2% decline. If we look at our combined differences and discontinuities estimator, so we include all these things, but then we have an interaction effect for Oregon market opening with being along the Oregon border, we estimate the decline is 44%. If we estimate just a standard traditional diff and diff model, we estimate the decline is 33%. And there, this is just a standard diff and diff where we haven't tried to adjust for the fact that maybe the counties along the Oregon border have a different trend than the fact that the counties along Idaho did. And so that might be one reason that our diff and diff estimator is like a little bit smaller, but still in the same neighborhood of what we're finding elsewhere. Any questions before we move on? So now we're going to kind of drill down into the gradient a little bit more. So we're estimating the effect of the Oregon market opening up for firms that are within 25 miles of the Oregon-Washington border. There we estimate the decline is 44%. When we look at firms that are 25 to 50 miles away, the decline falls to 16%. If we look at firms that are 50 to 70 miles away, we estimate an 8% decline, but it's not statistically significant. We look at 75 to 100 miles away, we estimate a 8% decline, but again, it's not statistically significant. We couldn't reject that this is 0. So one thing we could do is to estimate the Oregon market border opening and then create a continuous variable that says, what is your distance to the Oregon border? So this is like thinking, well, what if you had a store that was perfectly on the border between Oregon and Washington, which is a little bit of an impossibility, because there aren't any stores like in the middle of the Columbia River. You can't just stop on the bridge and get your pot to go. So you actually have to drive a little bit of distance. But that's what this coefficient right here is intended to approximate. And then based upon the distance that you are from the border, how much smaller does that decrease get? So this would estimate if there was a store that happened to be just barely on the other side of the border, right? If you could literally go up to the border crossing and purchase marijuana, the decline would be 69%. And then the further away you get from the border, the smaller this decline gets in absolute magnitude.
Portland's the biggest city in Oregon by a good measure, right?
It is, yes.
And it is right across the river, Vancouver.
Yes, it is.
So really the action we're talking about is that.
Not entirely. Yeah. So that's what we're looking at right here. So, so now we split things out by county. I appreciate the segue, by the way.
You're welcome.
So this is looking at where Vancouver is the excluded group. So the estimated decrease in Vancouver is 58%, which is the closest border crossing, not just for Vancouver, but for everywhere on Oregon along the East Coast, if you look at the earlier map that I had. But you're right, it is right across the way from Portland too. We could also look at this county over here in Klickitat. And if we look at Klickitat County, so I'll put in another county thing that I can just jump to so I don't have to flip so quick next time. There's no substantial Oregonian population over here, right? In this county, there's 25,000 people. In this county, there's 1,800 people. In this county, there's 2,000 people. It's not a big population, but it is the closest border crossing for everybody down here in Bend. And it is the closest border crossing for people down here in some other cities, right? So it's the closest border crossing for almost everyone out here in eastern Oregon. Yet there's no immediate large population on the other side of the river right there in Klickitat County. And when we look at Klickitat County, we find that there's, again, about a 50% decline, even for that group. So in terms of the absolute magnitude, yes, the biggest effects are in Portland. But in terms of relative magnitudes, we see a very similar one in Klickitat, despite the fact that there's no concentrated urban population on the other side of that border. Yet when we look at some other counties over here, we find in some the effect is practically zero, or in some the effect gets considerably smaller. But remember, for a lot of these other counties, they are not the closest border crossing for a lot of Oregonians. So if you're thinking someone from Oregon, whether they're coming from just across the river or somewhere in the state, they're probably going to go to some of the closest places that they can buy marijuana at. And so they're going to stop on that closest border crossing. And so in those places that aren't the closest border crossing, even if they're right across the border, we aren't seeing big declines there.
There are significant numbers of firms in Klickitat?
Yes.
Okay, so this is not just a measure of a couple of stores.
No. So, well, I think in Klickitat there was, so I think it's 3 or 4 firms.
Okay.
So relative to the population of Klickitat, there actually is a lot of firms.
Well, stores,
Yeah, it's a very abundant resource. So something else that kind of highlights that maybe there's effects that this border crossing is happening too is actually highlighted by this earlier comparison for Idaho. So if you look at Idaho, as a fraction of the population, those Washington-Idaho border counties account for 8% of the population in the state, but they account for 18% of the sales. And if you're wondering, well, maybe it's just all those people out in eastern Washington are the like pot-smoking hippies. Have you ever been to eastern Washington? That's Trump country, all right? So that's definitely not what that population is. There are like a fair number of colleges there, so we've done some things to also see is there just a disproportionate share of young people or college-age folks, and it certainly, that is not 18% of the population there, even though it does account for 18% of the sales. So we don't have any quasi-variation or quasi-experimental variation to exploit there, no exogenous changes, but just even that long-term characteristic that the Idaho-Washington border counties account for such a small fraction of the population, but such a large fraction of the state's share of sales is also suggestive that this is happening.
Well, that's right. Washington State and the University of Idaho are very close to each other, aren't they?
Yeah.
But that still doesn't account for it. Those aren't big enough places to be driving that.
No. So if you were to wonder, well, what are the other things that we see changing here? How are these firms responding? So, back to my Econ 101, class that I took oh my gosh, if I add it up, I'm not going to say 15 years ago. Yeah, it is. So when I took that, I learned when demand curves shift downward, we should see the price dropping, right? If we're moving along the supply curve. Yet when we actually look at the tax-inclusive price that these firms charge, we're finding that the price doesn't change at all. So this massive demand shock happened, and none of these firms altered their prices. So what did they do? Well, what we found, their revenues fell pretty sharply, their sales dropped, and they didn't really respond by changing the quality of marijuana being sold, so that stayed roughly the same. The main thing we found was that temporarily their inventories shot up. So they did have some idea this demand shock was going to happen. We spoke to some retailers on the phone. We're like, did you anticipate this? And they're like, oh yeah. And the reason why is that they have to look at IDs before they sell people marijuana. So they had some idea of how many IDs were coming from Washington versus how many were coming from Oregon. So they had some notion of this. And yet when they went to sell, or when it actually came time, we asked them what they did. They're like, nah, we ended up with extra marijuana for a while. So we just stopped ordering as much. So we let our inventories go up. So even though this isn't statistically significant, it is a pretty large increase in inventories, that those increased by 10%. And then they stayed higher for about 8 weeks afterwards, and then they slowly trended back to their original level. So they stopped ordering as much marijuana, absorbed it through increased inventories, but they didn't actually reduce their market prices in adjustment to this demand shock. So that suggests that these firms are actually able to be pretty elastic, that the supply of these drugs right now are fairly elastic, that firms can actually respond to it in an elastic manner, even if they aren't entering or exiting in the short run. So in this figure, this represents a series of about, I think, 100 regressions that we ran, where we estimated firm-specific changes in the amount of weight sold. So this reflects a percentage change. And then we estimated this for every single firm, and then just put a scatter plot out based upon distance to Oregon in miles. So distance to the Oregon border. And so we found substantial decreases in all the firms that are within about 20 miles of that border crossing. And then for the firms that are further away, once you get further up into Washington, we basically find almost no effect at all. And then we did the exact same thing for Idaho. And we find basically for Idaho, the point estimates, half the time they're positive, half the time they're negative. So basically along Idaho, there's no change at all happening. We did the same thing along the Canadian border. So based upon distance to the Canadian border, half the time they're positive, half the time they're negative. But the fraction that are statistically significant is basically that which we would expect if we were just rejecting the null hypothesis when it was actually true. So we're just rejecting the null at roughly the nominal level, which tells us that we're probably getting our standard errors roughly right as well. So this is evidence that the marijuana sales fell along the Oregon border, but then we could wonder, what are the other underlying mechanisms here? Because we don't see any other drops along the Idaho or Canadian border. And as I said this earlier, suggests some interesting things about the salience of this small-scale marijuana trafficking, that to many of these people, this probably felt like the right thing to do. That if they wanted to smoke weed and marijuana, or if they wanted to smoke weed in Oregon where it actually was already legal to smoke it, but they had nowhere to buy it, that the legal way to get it was to drive up and purchase it across the state boundary and drive back. Of course, that actually is a felony. And that has some pretty important law implications if we think about what's going to happen on the eastern seaboard when it gets legalized in Massachusetts, or it gets legalized in New Jersey, and then people take it to other reasons, feeling that this is a completely legitimate purchase, even though it's a felony to bring that across state boundaries. And given that people already do that a lot for cigarettes in New Jersey and New York, how much do we think this is going to happen with marijuana? So I do think this is going to be a natural consequence, though, of the partial prohibition world that we're entering into. So we're probably going to see this in some other places. So I'd like to get into some public health implications. In case you're wondering, is this drug trafficking or not? So I have like 3 more minutes. Okay. What we find is that when we look at small transactions for pre-rolled joints, those things only fall by 10%. If we look at single grams of marijuana, they're only falling by about 20. If we look at transactions that are greater than 6 grams of marijuana, so a much larger amount, that's where we find the decline is over 60%. So if we look at, is this people from Washington that are driving over to Oregon to purchase marijuana without paying taxes? Well, we find when taxes were introduced in Oregon in January, there wasn't any shift the other direction. So it doesn't gel with the idea of price shopping, because when prices went up in Oregon, there was no effect in Washington. All right. So we then use these estimates to suggest how much is being diverted out of the state, because this diversion is large and is significant on the border. But if we look at it statewide, it was about 11% of the market before. And if we apply our estimates to the Idaho border counties, if we felt that 40% of that marijuana was ending up outside the state, that suggests only about 7% of the marijuana is going out of the state today. So for public health implications, what we examined was traffic accidents from 2011 to 15 in Oregon. And then we looked at, instead of what happened when Oregon legalized marijuana, we estimated what happened when Washington introduced legalized marijuana, because that's when the spillovers would have started. And then we estimated, how did this differ based upon the distance to the border? And so what we find is, if we thought the spillovers of Washington legalizing marijuana were uniform statewide, we basically get a bunch of null effects. That there is no effect statewide of Washington legalizing marijuana on Oregon. This is alcohol-related traffic accidents, drug-related, or the probability an accident is alcohol-related, the probability is drug-related, and total accident counts. But we do find that when Washington legalizes marijuana, the fraction of accidents that are alcohol-related, or the count of accidents that are alcohol-related, falls. And then this effect gets reduced the further we get away from that Oregon-Washington border. So if there is any public health effects, we're finding evidence of alcohol and marijuana being substitutes, suggesting if there are externalities, they're actually positive ones. But you also might not pick up these externalities unless you consider the role that distance to the border has. So what does this suggest? One thing, if you're wondering, are marijuana spillovers and drug trafficking a big problem for California? Probably not. And that's because California is surrounded by a sea of green. It's legal in Oregon, it's legal in Nevada. The only place where it's illegal is Arizona, which is a pretty liberal medical marijuana state. There might be some spillovers there, but where are we really going to see this? Probably around Colorado. Not as much as we would if there were closer population centers. Where are we really going to see this? Massachusetts, right? New Jersey, if they legalize. So that's really where we're going to start to see far more substantial spillovers, and expect to see this probably, that'll be a story on CNN in the next 6 months, I bet. So some other stuff. What do we think about taxation policy? I don't have enough time to talk about all of it. But I'd like to cut to one thing that's interesting for tomorrow. So this is some research we're doing about price promotions. So this is price of marijuana sold in Washington based upon the day in April. So as soon as marijuana became legal, they discovered that there was this day that a lot of people wanted to smoke weed, which is known as 420. It's kind of the Black Friday of, well, it was just a celebration day. And after this celebration day became apparent, firms themselves figured out, well, maybe we should cut the price. So if you were to look at the average price on the 20th of the month, this is just an April thing. And if we were to look at what happens to the number of transactions, they quadruple on this day. And so we estimate the effect that this has for firms and competition, and we develop a theory of price competitions and price promotions as this relates to consumer holidays, which is kind of, if you're wondering about the building blocks of consumer demand, it's a weird thing to think about, because this is a day that demand shifts way to the right. And when I took Econ 201, I learned when demand curves shift to the right, what should happen to the price? It should go up. Mm-hmm. Yet we actually see prices are falling by about 20%.
But it's exactly the same thing as Black Friday, right?
Exactly. Which,
price.
And yep. Yet even though this is really common in marketing, we don't have a lot of theory about it. And so we develop a bit of theory and evidence, and we kind of test this in this model. So thank you a lot for your attention today and all of your questions. And I'm happy to answer anything else if you have them. Yeah.
I apologize, I'm going to have to leave in a few minutes, but I'm fascinated by this work, and I've been presenting and learning more about it. I'm a border health researcher. So
Yeah.
looking at the impact of how California legalization is impacting Mexico. So we have now a net south flow.
Yeah.
And there's missing research on this, so this is
Yeah,
an
yeah.
area in terms of substance use research. But the quality and potency.
Yeah.
In 2017, medical marijuana was legalized in Mexico. There's currently there's decriminalization of small amounts. You're familiar with this. So I think this is a fascinating next area, and I look forward to possibly collaborating at some point, but really thinking about how this access shift is changing, and less trafficking, less growing of marijuana generally in Mexico. So it's fascinating to see those changes. And your work is fantastic. Thank you.
Thank you. I appreciate it. Yeah.
So another basic hypothesis is that after liberalization, prices should have converged in the markets instead of we went through some slides very fast.
Yeah.
Did we see that adjusting for taxes maybe?
So I have some data from somebody in Oregon. He reached out to us that runs this firm called Weed Charts, where he runs some automatic daily web scrapers off of some of the marijuana websites called Leafly. And so with that, we have some pretty good daily data about marijuana prices in Oregon and Washington from this external source on Leafly. So it's not necessarily quite as good as the administrative data, because we don't know if they update their Leafly sites every day. But certainly if we were to look week over week or month over month, we could potentially estimate, price convergence or the law of one price. Do we see those types of things emerging? So I haven't tested for that yet, but it's certainly something we could look at in the long run.
Are the taxes very different?
They are a bit different. So in Washington, there's an excise tax of 37% at this point, and then local sales taxes that are nearly 10%. So the tax rate is almost 47%. In Oregon, there's an excise tax of 17%, plus local communities can add in an additional tax. So it's usually about 20% of an excise tax. And then there's some grower level taxes that are also added in the intermediate stage. But that roughly amounts to a tax rate of 25%. So they are taxed at different rates. Yeah.
Well, thanks so much for coming in, Ben. Thanks.
Cool.